Welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan, and here are the latest reports from the world of medicine. Light massage and music therapy may help reduce leukemia-related pain and fatigue. Cancer-related pain and exhaustion are typical detriments to the quality of life in leukemia patients. Pharmacological treatments have not been demonstrated to be effective in controlling these particular symptoms. In a new study that has been published in the American Society of Clinical Oncology journal, the researchers have found and discovered that light massage was more helpful and lasted longer than music therapy in managing leukemia-related pain and exhaustion in adult patients suffering with acute leukemia. In conclusion, both complementary therapies were shown to be beneficial at pain reduction and exhaustion, although mild massage has better results. Bisphosphonates effective as first-line treatment for osteoporosis or osteopenia. Bisphosphonates are a group of drugs that work by slowing the bone loss. They reduce the risk of hip as well as spine fractures. Bone renewal is also a slow process, but in many people an increase in bone density can be measured over a 5-year treatment period. Bisphosphonates can be recommended as a first-line treatment for the prevention and treatment of osteoporosis and can also decrease the risk of hip fracture among the general population, according to a recent study that has been published in the BMJ journal. Bisphosphonates reduce the incidence of hip fracture in the general population and in all the age groups. Zoledronic acid, risedronate, and alendronate reduce the incidence of hip fracture in osteoporosis or osteopenia populations as well. So the association between bisphosphonates and the incidence of hip fracture does not appear to be influenced by age. COVID-19 patients with existing hemoglobinopathy may have more complications. Hemoglobinopathy is a chronic condition in itself. Patients with hemoglobinopathy are a distinct group with unique health requirements as well. Cardiopulmonary comorbidities that develop as a result of the illness are one of the leading causes of death and morbidity in this particular population. Concerns have been raised about whether this group of patients are more vulnerable to COVID-19 infection and a more severe course of disease due to their immunocompromised status and even other related comorbidities. According to a new study that was published in the Frontiers of Medicine, clinical presentation and lab results in individuals suffering with this particular condition and those were identical. Patients with hemoglobinopathy died at a higher rate than the general population, and those who have underlying cardiovascular or respiratory illnesses should be handled with extra vigilance. Extended screen time in the youth tied to dry eye and blinking behavior. Excessive screen usage among the young population is a global epidemic with far-reaching ramifications for health and quality of life. Dry eye illness is becoming more and more common in the pediatric populations and is connected with altered blinking behavior during the prolonged screen usage. According to a new study, extended screen usage in a young population was related to blinking behavior and symptomatology comparable with individuals suffering from dry eye. These findings are published in the Contact Lens and Anterior Eye Journal. In conclusion, routine clinical screening, educational interventions, and the development of official guidelines on safe screen may aid in the prevention of rapid deterioration of ocular surface health and the quality of life in young people. The link that is present between excessive screen time and dry eye in young individuals merits additional investigations and the creation of interventions to address more comfortable screen use in young patients. Root canal treatment does not induce significant alterations in dental anxiety. More than 15 million teeth are treated and saved each year with either root canal or any kind of endodontic procedures. Endodontic treatments are necessary when the pulp, which is the soft tissue inside the canal, becomes infected or even inflamed. The inflammation or infection can have a variety of causes, either a deep decay, repeated dental procedures on the same tooth, a crack, or even a chip in the tooth. Root canal treatment does not induce significant alterations in dental anxiety, as per a recent study published in the Journal of Endodontics. The study concluded that self-perception on dental anxiety and fear was similar to other studies in a non-pandemic context. Patients with higher levels of dental anxiety and those that are treated in the strict confinement period presented an elevation in their heart rate. However, it can be stated that root canal treatment that is being performed by specialists like endodontists does not result in significant alterations in patients. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.